Welcome to another episode of Exercise Matters with me, Randall Cooper.
And me, Mick Hughes.
Support for today's episode comes from Premax Performance Skincare. If you're active, you focus on strength, endurance and recovery. But what about your skin? Sweat, friction and the elements take a toll. That's where Premax comes in. High-performance skincare made for high-performance people. From recovery creams to anti-chafe balms, massage creams to exercise-specific barrier creams, we help your skin go the distance. Keep your skin as fit as your body with Premax. Available now at premax.co.
And support for today's episode also comes from Learn.Physio. Health professionals, are you staying ahead of the game? Learn.Physio brings you cutting-edge education from world-class experts in sports and musculoskeletal medicine. Online courses, hands-on practicals and expert resources, all backed by the latest evidence and designed to fit into your busy schedule. To be your best, learn from the best. Get started today at Learn.Physio.
All right, great. Well, today's episode is all about eccentric exercise. Eccentric exercise is one of those things that I think that it wasn't really born in sports medicine and rehab, but it definitely kind of came to prominence. I mean, people have been talking about eccentric exercise all the way back to the 50s, if you look back into the literature there, Mick. But the whole Alfredson program for Achilles tendon issues back in the 90s really kind of put eccentric exercise on the map. But maybe unfairly now it's thought to be just a rehab physio kind of thing, but it's definitely got wider applications than that, doesn't it?
Yes. Yeah, 100%. Do you know the interesting fact about the Alfredson protocol?
What is it?
The man Alfredson himself, he was suffering from significant Achilles tendinopathy, and he basically wanted to rupture his Achilles because he knew that surgery would provide a great outcome for his disabling condition. And so he started this lengthening type program to try and break his Achilles. And in the end, he discovered that actually what he was doing was helping out of the perceived harm that he was creating came a whole lot of good. And that's how the Alfredson protocol was developed. So fun fact there for everyone.
I have heard that one. It's been a while since, because the Alfredson program's not as popular as once was, but that's definitely one. And that reminds me of the Robert Harvey story. Remember the ex-AFL footballer who played for St Kilda, and he was bothered by bilateral plantar fasciitis issues for years. Right. So he just decided to jump off the table, and he ruptured both simultaneously, and he felt great and played finals. So ever since then, it's just if you want complete resolution of your plantar fasciitis issues, just jump off the table like Robert Harvey did.
Just snap it. Oh, how funny!
You have to be selective with the patients you tell that story to, by the way.
Yeah, absolutely. The eccentrics would certainly, and you probably touched on this today, but eccentrics would certainly have a role to play. The bodybuilding community is probably known about eccentrics for a long time now, right? Like the whole concept of negatives that bodybuilders do, where they, get one of their big, bulked, heavy friend to help them lower the bar down to the chest on a bench press, and then they just push it back up for them.
It's a really good question, and we will dig into it, because definitely eccentrics has its pros and cons of both building muscle volume or muscle mass, I should say, and also strength gain. So there is some nuance there. So I think that we'll kind of talk that through. But maybe we should start with what actually eccentric exercise is. So eccentric exercise is lengthening of muscle under load. Using an example of, most people can picture, if they're listening to this, a bicep curl, where you start with your elbow straight, you lift your arm up towards your hand up towards your shoulder, and you lower it back down. The eccentric part of that contraction or that muscle action is the lengthening bit, where you're taking the weight down. That is different to what's termed a concentric contraction, where the muscle is shortening. So that's the lifting it up bit. And eccentric is where you're lifting it down. There's also isometric, where essentially if you were to hold that barbell kind of, let's say, in the middle, for instance, and just hold it there in a static position, that's an isometric contraction. But eccentric contractions can generate significantly more muscle contraction force than a concentric contraction, by the tune of actually 20 to 60%. So it's really quite significant. And I remember back in the day, I don't know, maybe you, Mick, when you were a younger buck, but
Mm.
You used to do bench press competitions with your buddies, and you'd load up the bench press nice and heavy, and you'd get it down and you could control it down. But as soon as you went into the concentric motion, that's where people failed all the time. And I think that that plays the part, is that you can manage a much heavier weight eccentrically compared to what you
Yep.
can concentrically.
Yeah, and I was terrible at those competitions. I would have probably 40 kilos on the bar and still couldn't put it off my chest. 40 kilos.
Yep.
But yeah, no, the absolutely that method of training, and it can be applied to all different types of machines and free weight exercises. But yeah, that lengthening contractions really key.
Eccentric contractions also require less energy. They require less ATP. And that's why, if you think about walking up a hill, and I know you've got a hill out the back of your
Mm.
place there that you walk up and down often, walking up seems a lot harder than kind of walking down. And it does feel, it is easier. So because of that lower energy demand is used, these type of eccentric exercises or activities are used with people with limited exercise tolerance. So if you think that you've been in a period of detraining or deconditioning, you've got certain kind of medical conditions, or even for older adults who are exercising, an eccentric bias or an eccentric kind of program can be really beneficial. But I think using the example of kind of walking downhill, for instance, what we know is that it is easier, but it can lead to much higher delayed onset muscle soreness, DOMS. So,
Mm.
and I think most people feel that they haven't been bushwalking for, a few months, and then they do a bunch of hills and their quads and their calves are screaming, a
Yep.
few days, a couple of
Yeah.
days later.
Yeah, that's what I was gonna bring up. Yeah, that obviously we've all experienced it, and I think that would be just the careful consideration, is that if we are going to go down this path, and obviously by the end of this podcast, we'll know how to probably program them a touch better. But yeah, just they do produce more inflammatory stress and tissue damage, so we just got to be careful with the amount we give.
And we know also that the eccentric exercises tend to target the tendon and the musculo-tendon junction really well. And I know that's kind of a bit technical, but we'll dig into that maybe when we're talking about the rehab kind of stuff as well. So that's the concept of what eccentrics are. But how are they done? So the first is that generally, like most people, and I agree with this kind of way of categorizing it, is that you talk about like classic or pure eccentric movements. And we touched on one a couple of episodes ago, Mick, with the Nordics. So the Nordics is where someone is holding essentially someone's the shanks of their legs, and they're bending through their knee to lower themselves down towards the ground. So it is a lengthening of the hamstring and essentially nothing else. So that is a pure eccentric exercise. You can also do eccentric squats. There are machines, there's eccentric bicycles or whatever. So those pure play eccentric exercises can be done, but they are generally hard to do. But I think what most people will do as part of a program is an eccentrically biased exercise program. So what that will mean is like really reinforcing or emphasizing the eccentric component. So using the example like a single leg RDL, like where you're really focusing on the lowering component, and then you're kind of coming back up, you're really focusing on a slow lowering down. Sometimes you'll do, and I used to give this a lot from my Achilles patients back in the Alfredson days, is that you do a heel raise exercise, you'd go up on two legs, and then you just drop down on one, and you do that with some weights as well. And then there's quite a bit of research in recent years on devices like the flywheel that overemphasize and really target that eccentric loading of like a jump or a squat or that kind of things. Eccentrics are part of normal exercise, but I suppose it's got to do with whether you want to kind of completely isolate it, or whether you want to kind of have an eccentrically biased program for certain kind of conditions or problems, or even just the right kind of strengthening, for instance. So yeah, that's the way it's
Yep.
categorized.
Yeah, awesome. A little fun fact there too about, and this is talking to Jill Cook a while ago about this, and some of the tendon research they've discovered that. And it sort of leaned into the whole metronome and pacing. So often, like, we'd get someone to do a concentric, contraction up and down. Most people, their number count is so far off true time, it's not funny. So that's what the metronome pacing, whether it's you set a metronome at 60 beats a minute, you actually get a true 1 second count. You ask someone to do a 2 seconds up, 2 seconds down, it's probably half a second up, half a second down. So what she found, and what some of the research around this area has found, is that if you actually set it for 60 beats a minute and actually overplay the eccentric component. So they'll often prescribe, 3 seconds up, 4 seconds down for some Achilles base work. And I've been applying it with my ACL patients where on a knee extension, I'll go 2 up and then the injured leg down for 4 seconds with the metronome. They found certainly the excitement in the brain for the tendon population, the excitement in the brain and the improved cortical pathways has certainly improved as well, which kind of makes sense. We know that if you're slowly lowering, you're putting a little bit more kind of, I guess, emphasis on that contraction. You've got that external pacing, it can help as well. So a little tip there for those if we want to get those eccentric contractions in, sometimes that longer duration eccentric can be really helpful.
That's an awesome tip, and it's something that, like, when we did do that series with Jill, I was there kind of filming with her, and I thought, this is really good stuff with the metronome. So often when I'm exercising in the gym, just to get myself pumped up, I will put on dance music, and dance music generally is about 120, 130 beats per minute. So it's essentially like 2 beats every second. So you can then, if you kind of start to do it in timing with the music, then you're doing 2s rather than 1s, if that makes sense.
Yep.
Then you can really emphasize particularly that eccentric component. The other thing I think that's really cool about the eccentric component is, for me, if you're really focusing on the lengthening component, let's say we're using the bicep curl example again, if you're really thinking about slowly letting that weight down, controlling that movement, it promotes movement quality. And I think that that's one thing that, when we talk about exercise, thinks about every exercise is essentially is standard, and everyone does the bench press the same, everyone does a squat the same, but they don't. There's quality of movement. And I know that when I've been kind of coaching and teaching my patients the right exercise technique, if they focus on that eccentric component, you're usually assured that the quality of the movement's going to be really good, and they're going to control it well.
Yep, agree. I've had that experience too. I'd actually love to see your dance moves, mate. If you're putting the music on in the gym, what's your favourite one? Pulling out the lawnmower or the sprinkler? Are you what kind of moves are your
my
faves?
dance routine has completely changed since Ray Gun last year. So she has been very inspirational, and it always gets a reaction. So thanks to Ray Gun for that. All right, now the 3 things that I wanted to kind of cover in this cast was the first of all, what role does eccentric exercise play in strength gains and also muscle adaptation? It's a really interesting topic. I've got some nice studies to talk about there. Secondly, do eccentric exercises improve athletic performance? Can you run faster? Can you jump higher? Can you change direction any better? Like, those are the things that we'll touch on. And the third is, and we won't spend too much time on here because, like, we'll just get into too much nitty gritty, won't we, Mick? But the rehab and injury prevention kind of stuff, you did an excellent job of kind of talking about Nordics and that kind of thing a couple of episodes. So for people who really want to dig into that there's more kind of around that topic in that podcast. But let's jump into strength and muscle adaptations and narrow in particularly on strength gain. So there's been an explosion of research in exercise generally, but particularly in eccentric exercise, probably over about the last 15 years or so. Roig and colleagues back in 2009 published a wonderful systematic review and meta-analysis in the British Journal of Sports Medicine. And they looked particularly at does eccentric exercise equate to strength gains? So they included 20 studies in this review. And what they found was that high-intensity eccentric training loads leads to greater strength gains in total and eccentric strength compared to concentric training. So generally, like, if you're looking to get strong, then biasing or doing eccentric exercises will help improve your strength faster than focusing on the concentric one. And this is overlaid because the second point they made was that strength gains from eccentric training are more specific to the movement type and speed used during training. So for instance, if you're looking to improve your hamstring strength, for instance, then if you do eccentric bias program, then your hamstrings generally will get stronger, but especially your eccentric hamstring strength will benefit from doing eccentric strengthening. Obviously, that just makes sense, doesn't it? When it comes to things such as injury prevention and high-speed running and that kind of thing, most injuries occur in an eccentric, muscle injuries, I should say, occur during an eccentric kind of contraction. So I think that that's super important. Then the last thing that the systematic review kind of summarized was that eccentric training effectively increases muscle mass with evidence of greater muscle girth and cross-sectional area on MRI and CT. So those three things combined is that you get strong, you get particularly strong with an eccentric contraction when you train eccentrically, and you can build muscle as well. Then I think that the case behind using eccentric exercises to improve your strength is really strong.
Yep. Yeah, it's pretty overwhelming evidence there. There's obviously, yeah, that specificity of training is super important, as you said. If you're going to train eccentrically, you're going to get strong eccentrically, and having that greater muscle volume is going to be protective. And we have seen that. There's been studies where they've looked at the quadrant of doom brings to mind from the Nordic hamstring group, where we've got long and strong hamstrings. So those that have been trained in a lengthened fashion, so they get longer fascicles, they get stronger muscles, are in that lower risk category on the quadrant of doom. And then conversely, you've got your short and category of hamstrings, where it's going to be much more likelihood of getting injured. So certainly, yeah, it's protective, but it's also great for strength and muscle building.
Yeah, no, agreed. That kind of nicely moves into the second study that I want to talk about, which was done by Douglas and colleagues and published in Sports Medicine. And this was a little bit more recent in 2017. And they focus a little bit more on muscle hypertrophy and also the change of muscle architecture with doing eccentric exercises as well. There's a few more studies to kind of include here. They included 40 studies, and they really looked at the longer term adaptations of eccentric exercise. And what they meant by longer term adaptations was greater than 4 weeks of doing this program. So firstly, what they concluded was that eccentric training results in greater improvements in muscle strength, although in a largely mode specific manner. So that reinforces kind of what was in the Roig study. Then secondly, it said it's at least as effective as traditional resistance training for increasing muscle size, with unique adaptations, including the addition of increasing sarcomeres in series and the preferential growth of type 2 muscle fibers. So that fits in beautifully with your comment, Mick, where essentially like the fascicle length, the bundles of muscle fibers are increasing and lengthening, which we know is protective, which is really good. But I think probably the most kind of interesting addition to that is that it tends to specifically target those type 2 muscle fibers. So type 2 are the fast twitch fibers, the ones that are involved in sprinting, agility, plyometrics, fast movement, as opposed to type 1 fibers that are more of the slower twitch fibers, slower twitch as well. So if you're in a sport that requires fast movements, and that's most sports, by the way, unless you're playing billiards or darts, then eccentric exercise targets those fast twitch fibers. I think it's a really important addition to that first study. What do you think, Mick?
Yep. No, I agree. It's a really good point. I think the only question I've got here is, and maybe it's sort of devil's advocate here or throwing a cat amongst the pigeon, is that I guess the downside, if we think about sport being played fast, these eccentric contractions are slow. So it's kind of like that would be my question, would be that there would have to be some kind of transition from developing those strength qualities. If we, even from a muscle, it doesn't necessarily mean to be in the rehab room, but certainly if you're starting out and you're an inexperienced athlete, you want to build some strength and some size for the sport that you're playing. It sounds like it's advantageous to get in there and do some eccentric training. It seems to be protective. It helps with hitting the right muscles and developing the right qualities. But I think if you train slow all the time in the gym and probably didn't do the on-field training to train that bit more quicker for the demands of the sport, we might also run into problems. What do you think about that, or been shown in any of the stuff you looked at?
I don't think it's actually kind of borne out in these studies, because the studies are obviously quite dry in that they're looking at essentially the fiber types in response to these exercises. So I suppose what you're building is actually the fiber type. The type 2 fibers probably increase in size and they grow, but then you've got your neuromuscular adaptations as well. So that's where I think that specificity of agility training, doing stuff that's fast, teaching the nervous system to fire up those muscle fibers and those motor units quickly is exactly what you're talking about. So I agree with you.
Yep.
You can't just do eccentrics and think that you're going to run like gout. I think that you need to kind of run like gout and also kind of do eccentrics to make sure you're strong. Yeah.
Yep.
Although he saw that he got beaten the other week. So
he got pipped at the post. Yeah. Gosh, he's impressive. I've watched a slow motion video of his foot contacts. He's just got these wonderful springs that just that ankle stiffness is incredible for him to cover the ground. And one race, he literally won by about 30 or 40 meters. I watched him do this
Yeah.
race over a 200. It's so impressive.
He's running faster than what Usain Bolt did at the same age. So he
Just
could
hope
be
he stays
anything.
injury free. Just hopefully he can just build some good seasons into his legs and not break down.
Well, we'll see. I was very surprised he got beat the other day. So
Yeah,
maybe that's a good reality check for him, because he's certainly got
yeah,
the swagger of a sprinter at the
yeah,
moment as well.
yeah. It's awesome. It's good to see Australia's athletics is in a good spot.
That's it. That's good to see. So the other thing that that the Eccentric program will enable is it enables you to do what the S&C and the exercise physiologists will call super maximal loads. So essentially, like using that bench press example, as I kind of gave at the start there, where you can kind of lower it down, but you can't get it back up, then there's a heavier weight. And they think that somewhere in the vicinity of about 120 to 140% of a 1RM. So if you whatever you can kind of push in one rep, you can do more than that by the tune of 20 to 40% if you just do the eccentric component. And by doing that, it's a higher mechanical tension that goes through the muscle, and that stimulates a very unique neuromuscular adaptation, and it allows the recruitment of higher threshold motor units, is the kind of the term they use in the paper, which basically means that your nerves are firing up more of the muscle and teaching the nervous system to use as many muscle fibers as absolutely possible, compared to doing a concentric contraction as well. So the analogy I usually give, kind of like in my practice and to people, is think about a car, a V12, and it can run on 2 cylinders, 6 cylinders, 8 cylinders, 10 cylinders, 12 cylinders. So most of the time when you're getting around, you're on 2 cylinders, but in this exercise, you're firing up every single cylinder that you've got available, and then you can kind of put your foot down with as heavy as you can go. So those neuromuscular adaptations, I think, are as important as actually building the fiber types and some of the other stuff that we just mentioned as well. So that's as far as strength gains and muscle adaptation, I think we've covered that off, unless you got any comments there, mate.
No, it's great coverage, and yeah, I like that analogy. I think if we've got some heightened nervous system, then we can basically recruit as many fibers as we can. If we're breaking them down with eccentrics and we can get those nerves firing, then it's going to result in some pretty good outcomes, both from a performance level but also strength level.
Yeah, no, I agree. So then the next topic is eccentric training and athletic performance. So does it actually make you run faster? Does it make you jump further? And the short answer is yes, it can. Many athletic movements require what we call the stretch shortening cycle. So think about kind of like in basketball. You love basketball, Mick. So someone lands, does a layup, they land, and then they've got to go straight back up to try and tap it out again or get the rebound. That's that ability for the body to kind of essentially land, break, and then instantly kind of go into a concentric contraction again is something that's integral to being a good athlete. And there's that Douglas paper that I mentioned before kind of said that eccentric exercise definitely kind of helps with the strengthening in the eccentric phase, can help this recoil effect. So I think that's really important. There's another paper by Zhang that was only published last year in Frontier in Physiology. And what they found was by doing eccentric exercises as well, it can improve movement speed and also short distance sprint speed. So they call it the first step of any kind of athletic movement. So if you're in a sport that requires change of direction, jumping, landing, short takeoffs, that kind of thing, and the sport that springs to mind, or a few, would be like AFL football, obviously, tennis would be another one, then these eccentric exercises would be really good. And then the third thing that pops into the literature quite a bit, and this is where I think the everyday athlete will struggle to get their hands on it, is the flywheel, where in elite gyms and sports teams, etc. It's essentially just a disc that kind of rotates with a strap or a cable that you're connected to, and then when you're doing like a squat, for instance, it really increases the load that kind of goes through that eccentric kind of component as well. But that eccentric overload has shown that, that those change of direction tasks have improved markedly by measuring things like shuttle runs and T-tests and sports-specific agility drills and whatever. So answering the question, does eccentric exercise help with that quickness of movement and athletic performance? It seems that it does.
Yep. Yeah, it makes sense. Like if you've got the ability to handle, like just going back to that plyometric analogy, like if you've got to get off the ground as quickly as possible, you're doing repeated jumps. Yeah, there's going to be that lengthening moment where your foot has to sort of, go back, and that takeoff, what you were just describing, every time you run forward, you got to push backwards. So your calf and Achilles on length. When you're landing from a jump, your quad tendon and your patella tendon go into this lengthened state, and all of a sudden now they've got to recoil. So I like a rubber band analogy, where if you sort of get a rubber band between your two fingers, you pull on it, and you only pull on it a little bit and let it go, it's going to fly so far forward. You put it on a bigger stretch and it's going to fly much more forward. So to sort of probably put that into a visual representation of what happens. So if we've got a much better lengthening contraction, the ability to do that and put a muscle on length, and then it's better, it's going to fly more. And so I like to sort of show that to my patients too, to describe why we are doing these eccentric components, but also too why we're adding in the plyometric exercises too to top it up.
Let's just quickly touch on and rehabilitation and injury prevention. I do only want to touch on it because, like, we don't want to make this a class on tendinopathy, but we did talk about that Alfredson program back in the day in the 90s that was an eccentric loading program for what we call the musculotendinous unit. So the tendons, for a lot of people, think that they're just an inelastic structure, and it is. They're quite rigid, but they do have some pliability to it. But there is a zone above each tendon where you've got a crisscross of fibers between tendon fibers and also muscle fibers as well. And this area is called the musculotendinous junction. And eccentric exercise really kind of focuses and strengthens up that area really quite nicely. And I think it's really important, not only for people who are suffering problems with their tendons, but also, I'm sure you've had plenty of patients come in, Mick, who have got, like, I don't like the expression super well, but it's like the old man's calves, those kind of niggly, kind of gritty, kind of muscle soreness and muscle issues that just don't tend to go away for a long time. And in that musculotendinous junction area, I think an eccentric program for people with that is very important.
Yeah, it's classic presentation. It's profound how much use, like your calf, like you got your weekend warriors, and calves as we get older, and it's one of those things you're going to see injuries across the board. But calves, I agree, 100%. It's one of the simplest measures I've been able to improve patient symptoms just by getting them to focus on some strengthening of their calves, particularly biasing that eccentric component. It's tidied up a lot of their sorenesses and their niggles and their tightnesses. And, people often present saying, I've been stretching in my calves. I've got these tight calves. I've got these sore calves when I go to run or play sport. And, I stretch. I'm trying to lengthen them. I've been told to lengthen them. But that's the difference, right? So when you passively stretch a tissue, like a calf stretch, like push the wall down kind of stretch, we're just passively changing the length. We're actually not breaking down any tissue. We're not doing it in the same way. Yes, we are lengthening, but it's a short-term lengthening effect we're having on the muscle. This isn't a longer sustained breakdown of muscle cells to line up the sarcomeres and to improve the fascicle length, unlike what we can get out of the strengthening program focusing on the eccentric. So just important differentiation there for those that aren't physioed.
Good point. All right, let's put it all together just for your everyday athlete to kind of bring it home. So I think the first thing is if your sport involves eccentric movements, i.e. like you land, decelerate, downhill motions, integrating some eccentric biased exercises into your training is a good idea. So think about sports such as skiing or trail running, basketball, netball, CrossFit, those type of sports. If you do those kind of sports, eccentric exercises are going to be good for you. If your sport requires changes of direction, acceleration, deceleration, then I'd recommend that people put in some eccentric focused training to improve that movement control and reducing injury risk. So particularly field sports, tennis, racket sports, martial arts, that kind of thing as well. So those 2 points I think are clear. If you are recovering from an injury or you're dealing with a medical condition, or even like, we just spoke about before, Mick, that you've got these niggly injuries, etc., go and see a practitioner. Like get it sorted out. As much as you will say, listen, I've listened to the podcast with Randall and Mick, and like the eccentric exercises sound like the magic panacea. It's not the case. It might be that practitioners can integrate that exercise and get a comprehensive plan and make sure you're getting professional to kind of help you out. So,
because I can add, there's probably one particular condition where I know that eccentric or lengthening loading can actually provoke, and that being the insertional type Achilles condition. So not we've been talking a bit about the Alfredson protocol. We've been talking about the benefits of that, but that mid portion Achilles, so just right in the middle part of the Achilles, that's where, that benefits greatly. But the one where it actually get that pain right at the base of your Achilles, right on the back of your heel, we actually know that can be quite provocative. So that's a perfect example of, why we need to be seeking health professional advice for these ones, because sometimes you can make your conditions worse if you just pick up something that you read or hear on the internet and try to run with it yourself.
And with AI, like AI will tell you exactly what to do and give you a program, but if the diagnosis isn't correct, then you're going to be in all sorts of troubles. Yep. Yeah, I think that's important. I think we're kind of coming home. The only other thing that I was going to say is that a lot of these pure play eccentric exercises are hard to integrate into an everyday kind of program. So if you are looking to integrate kind of eccentric exercises into your program, then just think about the biasing, like we spoke about before. The lowering component just needs to be a little bit slower, go a little bit heavier. If you do have people that can help you out by kind of aiding and assisting, like in a gym, for instance, then that's great. But just focusing on that eccentric contraction for a lot of people, I think will just be enough.
Yep. It's such a low-hanging fruit. Such a low-hanging fruit that we can incorporate. We've just got to be careful with the dosage per week. Once again, people that are just starting out probably could only handle a couple of sessions a week. That's targeting the eccentric. As your training history improves and as you become more tolerant and the DOMS goes away and you're feeling more comfortable, that's when we could probably add that third session per week. Once again, make sure you're working with a good sports physio or a good S&C coach or exercise professional to sort of help you achieve your goals that way.
Great way to wrap up, Mick. Well, that's a wrap for today's episode of Exercise Matters. If you enjoyed the chat, make sure to subscribe, leave a review and share it with your mates. A quick disclaimer, this podcast is for educational purposes only and is not medical or individual advice. Always seek guidance from a qualified health professional for your specific needs. Big thanks to our sponsors, Premax, high performance skincare for high performance people, and Learn.physio, world-class education for health professionals. Catch you next time. Thanks, Mick.
See ya. Bye.